And now a moment from Your History and Health comes first with Dr. Richard Brown.
Hello, everyone. Welcome back to Your History and Health Comes First. This is Dr. Richard Brown, and it is April 20th. So, what I want to talk about this week is something that's dear to my heart since I've spent 35, almost 40 years in the healthcare field, fighting for those who can't fight for themselves and trying to keep people safe and alive and healthy. What am I talking about? Mask mandate lift. Okay, yesterday witnessed another setback for public health and for the safety of the American population in the United States. CNN reported that there was a district judge by the name of Catherine Kimball Mizell. She struck down the Biden administration's mask mandate for airplanes and other public transportation methods. And this is not good. And of course, Biden administration at this point has said that the mandate order is no longer in effect until, something else happens with this particular ruling. So Mizell, the judge, 34-year-old newly appointed judge by Donald Trump in 2020, stated that the mandate was unlawful because it exceeded the statutory authority of the U.S. Centers for Disease Control and Prevention. It says it's a violation of the law. Now, I went and looked at the ruling. It's 59 pages. I read all of it, and I'm not going to talk about the details of the lawsuit that was filed and all that they said. But what I will say is that this was a ruling and a decision made from a legal decision or a legal opinion, not made from a scientific opinion, from a opinion of health experts, but an opinion made by a newly appointed judge about what they think the law says or does not say, or what has been extended, or what boundaries have been extended. So as of April 19th, the mask mandate has been lifted. And so I think it's making America less safe. And I'm thinking also that based on what we know, which is number one, the virus is still here. Its only mission is to kill, and it's continuing to do that. So again, it was based on a legal opinion, not a public health opinion. This is a huge shift in the travel policy in the United States right now. So the mask mandate for airlines was put in place February 2021. It was implemented by the Biden administration. And it was to be lifted on May 3rd, which is only about 12 days away. So that's not far away. But it's being done too abruptly, in my opinion. The ruling took place 2 days ago, and now it's already in effect. And there were TV coverage that showed airlines carrying bags down the plane aisle and passengers throwing their air mask into the bag, celebrating the fact that they are no longer protected, celebrating the fact that they believe this microorganism virus that they cannot see is gone and will not affect them or their relatives because a legal decision was made and implemented abruptly in like 24 hours. So only 12 days ago, what should that matter? Well, it matters a lot. 12 days is 12 days. A lot can happen in one day. 12 days is a lot. That time was needed by CDC to continue to assess data, continue to analyze data, and continue to make a informed, scientific, intelligent, analysis-based decision about lifting the mask. So why else does it matter? Let me tell you. Number one, the COVID-19 variant BA2 is the latest variant. It is more deadly than the Delta variant. It is here. So it matters because the variant is here, the disease is still here. Number two, why does it matter? 30,000 people are being diagnosed per day with COVID-19, either Delta or BA2. That's the second reason why it matters. The third reason why it matters is that people are still dying at the rate of 500 people per day in the United States. That's why it matters. 500 people a day. If we had waited 12 days or 10 days, then some of that 500 per day may not die within that period because maybe they would have had a mask and not subjected themselves to the virus and or spread it to any of their loved ones because the analysis wasn't completed. Number four, 150,000 people are still dying a year from COVID-19. 150,000 people. I know people that have died. Many of you probably know people who have died from COVID-19. That's the reason why it matters that it shouldn't be lifted so abruptly. Another reason is that people are experiencing something called long COVID. Long COVID, we just heard about that several months ago. People who, even though they've had the disease and survived, they're still suffering symptoms of the disease months after their immune system has fought off what they thought was, the dangerous part. But still, there's other things that are taking place that are called long COVID that are affecting people, and it has to do with heart and lungs and other organs that aren't functioning as well as they should. So what's really important, the major reason is to prevent illness and death, is to not get sick in the first place. And so that was the purpose of the mask, which is to try and keep you from inhaling those droplets into your nose, into your lung that will cause death in the first place. And the last but not least, and there's probably more reason why it matters that you shouldn't do this abruptly and lift the mask mandate, is because guess what? Have we not forgotten that children under 5 in this country still are not vaccinated because there has not been a vaccination approved for children under 5? But we're going to lift the mandate knowing that the virus is still here and subject our children and other vulnerable people to the disease. The vaccines work, we know that. The vaccines work, tried, true, proven, they work. But for children under 5, it's not here yet. So if it's not here yet, why would we not be more cautious and suffer a little inconvenience of wearing a mask and wait a few more days to see what the data says about children and or whether the vaccine is approved for children within that time period? It just doesn't make sense to me. Let me ask you a question. Many of you have children, some of you are children yourselves, some of you thinking about having children, but I'm gonna ask a question that I think all of you could answer. Would you send your infant child who probably can't walk yet, infant child, maybe just came out of your, maybe just crawling around, would you send them out into the world alone before they could walk? Absolutely not. You don't want them out of your sight before they can walk because they might pull up on something and burn themselves or put something in their mouth because they aren't ready yet. It's not safe. Your job is to protect them and keep them safe. So you would not do that. The child has no experience, has no knowledge, doesn't have the capability to be alone without parental supervision. The judge who made this ruling to stop wearing masks too early, she doesn't have the knowledge. She doesn't have the experience. She doesn't have the capability to make such a decision. Not like doctors and scientists and researchers who have spent a lifetime fighting viruses and bacteria and keeping people alive and safe. Yes, she has a law degree. She has a particular political persuasion and thoughts about how the world should operate, which is why she got appointed by Donald Trump in 2020. She's brand new to the bench. Let me ask another question. So would you let your child cross the street while traffic is very heavy, going east, west, north, south, Mack trucks, big cars, motorcycles? Would you allow your child to cross that street with all that traffic going on? Of course not. You would protect them. You would err on the side of caution and say, well, they might be able to get through without getting killed. But I'm not going to take that chance. I'm going to keep them over here on the sidewalk, and I'm not going to let them out in that traffic until it is safe. Lifting the mask mandate too early is like looking only one way when you're crossing a street. Doing this increases the risk of injury and death in both cases. So, yes, it is true that flying in airplanes is fairly safe. And I've flown my own airplanes. I talked to a friend of mine who flies his own plane. I talk to him every week. He happens to be a physician as well. So I know about flying, I know about planes. And so it is safe to fly airplanes, and the commercial planes have enough of air flowing through it, high degree of circulation, such that the risk of obtaining the virus, is minimum. But it's not 100% safe. And the terminals, the airport terminals, are definitely not safe. And so people are going to tend to just, with this ruling, tend to just not wear a mask anywhere, not in the terminals, not in the grocery stores, not at large gatherings, not at family events, not at the clubs, not at the dances, not at the church, not in the choir. People, I believe, are just going to, in general, just say, oh, it's over, it's safe. And a lot more people are going to be infected with this virus. And there are going to be more people to die who should not have to die because of the abruptness that this mask mandate is being lifted at. So sitting on the plane next to somebody while the air is circulating pretty well, it's good, it's okay. But if you're sitting next to someone who has COVID-19, who has Delta, who has AB2, and they sneeze on you as they reach across to pass through your peanuts, and then you inhale the droplets into your nose and into your lungs, and within days, you now have the virus, and subject to all the pain, the suffering, and danger that the virus comes to, then it's worth it for you to have a mask on. I plan to travel a couple of times in the next couple of months. I will wear my mask. I continue to wear my mask in large gatherings. Now, let me say something about masks. We know now, and again, there's a lot we didn't know in the beginning about this virus and how to protect ourselves. We know now that the KN95 masks are the best to wear, the ones that are snug around your face, such that no particles can get in. Now, people who wear beards and have facial hairs, there's openings on the side where droplets can get in, and so even them may not be as safe with a N95 mask. But they do work. I will continue to wear mine for a while. The other reason too, in terms of talking about what matters and why I'm going to continue to wear my mask appropriately, where I feel and I think I need to, is that in the beginning we talked about something called herd immunity, that the United States had to get to herd immunity before we could be safe and feel comfortable about this virus being in our environment. We needed to be at least at 75, 85% herd immunity, vaccinated. 75% of the population needed to be vaccinated in order to achieve herd immunity. Well, we're not that yet. I believe we're only 68 or 70% vaccinated in the US. And so we haven't even achieved that. So there's lots of reasons why a decision based upon a legal opinion should not have precedent over decisions made by scientists and doctors and researchers and hundreds of people who have studied these diseases, these viruses, and these bacteria for their entire life and for years and years and years. And as we know, many members of the minority community have a lot of underlying medical conditions. These individuals too are very, very vulnerable to this disease and can have negative impacts as a result of catching it. So Blacks in particular among the minority group have a lot of health issues, a lot of health disparity, a lot of health inequality that exists in the United States. So these reasons also lead me to be very cautious about this abrupt lifting of the mandate. So what is health equity? Health equity is when all the members of the society enjoy a fair and a just opportunity to be as healthy as possible. And the public health policy that existed in this country for years and years and years, which the judge referred to as being old and didn't necessarily apply to where we are now, have kept us alive and safe. That young lady, 34, fresh out of school, haven't seen smallpox, haven't seen diphtheria, haven't seen the plague, haven't seen chicken pox, haven't seen measles, haven't seen polio, haven't seen a whole lot of diseases or people with those diseases. And so just from a person being on planet Earth, just have not had the experiences that a lot of other people have had and should not have the authority to make a decision, a life-altering decision, a life and death decision by simply lifting a mask mandate that all these other important, smart, intelligent, scientific people said should be in place. So I believe in public health. Public health believes in people, and it has kept us safe. So the COVID-19 pandemic, of course, has brought social and racial injustice and inequality to the forefront in public health. It has highlighted that health equity is still not a reality where COVID-19 is concerned. The term racial and ethnic minority groups includes people of color with a wide variety of backgrounds and experiences. Negative experiences are common to many people within these groups. Some are social determinants of health, and they have their historical and preventive reasons as to why people are not in good condition. And it has to do with, their economics or their education or where they live. Many of those social determinants of health, where they play, where they worship, where they live and work, where they learn. And so lots of factors out there that exist within the minority population that makes them high risk for negative impact, negative outcomes when you catch this virus. So high risk refers to those factors that have been published, and a meta-analysis has been done on it. There's been systematic reviews completed by the CDC process. There's been meta-analysis and reviews done that strongly indicate that there are risk factors associated with certain conditions. And that if you catch AIDS, not AIDS, but well, AIDS, yeah, if you catch AIDS, there's some risk factors associated with that too. But we're talking about COVID-19. So if you catch COVID-19, there's risk factors that are increased, that become more severe if you have certain conditions, these medical conditions, predetermined medical conditions. Some of those include cancer, and there's lots of people with cancer. I think it's the second leading cause of death in the United States is cancer. So a lot of people have got it. And so catching COVID is going to increase their risk of death. Those with cerebral palsy, chronic kidney disease, pulmonary embolisms, pulmonary hypertension, uh, bronchiectasis, people with COPD, chronic obstructive pulmonary disease, people that have liver disease. All of these people have an increased risk of bad outcomes if they catch COVID-19. There's cirrhosis of the liver. That comes from doing a lot of drinking. And we know alcohol is legal in this country, even though we know it causes brain damage and damages your liver. Lots of people drink it. They're vulnerable. People who have liver disease or who have hepatitis are more vulnerable. Cystic fibrosis, and I don't have the numbers. When I was chief of the Bureau of Special Healthcare Needs in Missouri, I had the numbers, but there's a huge amount of people that are born with cystic fibrosis every year, not as much as in the past. And every state in the unions pretty much have funds dedicated by the Congress to take care of people with cystic fibrosis. So they're vulnerable. People who have diabetes, and that's diabetes 1 and 2. And there's lots of people with diabetes. Lots of people with diabetes in this country. I mean, the leading cause of death is heart disease, cancer, and stroke. All of these people are at increased risk of bad outcomes if they catch COVID. These are all reasons why we should keep that mandate in place as long as we can until we either get herd immunity or we get enough data to support the fact that we can provide vaccines for children. We're not saving our children. We're putting our children at risk. There are people also who have limitations in terms of taking care of themselves, in terms of active daily living. There's people who are intellectually and developmentally disabled. They have learning disabilities. I mean, they just don't understand some stuff. They just don't necessarily get it. But if they see you wearing a mask because you want to protect them and insist that they wear it, they might wear it. But if nobody's wearing a mask, they may not have the capability to determine for themselves that they need to be wearing a mask because they have this disability or they have this condition that predisposes them to bad outcomes if they catch this disease. So there's a lot of misinformed, and I dare say, folks who elevator don't go all the way to the top, or who's 2 or 3 French fries short of a Happy Meal, or however you want to put it. We know those people are. And there's lots of people who have been affected by lead in the soil and in the paint. We need to protect those people. They're here. That's what public health does. Public health is interested in saving all human beings, no matter what their color is, red, yellow, black, or white, all are precious in God's sight and in the sight of public health officials. People who have spinal cord injuries or vulnerable heart conditions, I mentioned HIV, mental health problems, obesity is a significant health condition that contributes to bad outcomes when you get COVID. I think that it's about 60 or 70% of the people who are dying from COVID fall into the category of being obese or elderly. Now, the elderly, 85, 90, 100 years old, they lived a long, long life. They should be respected, should be protected. They should be studied and learned from. We should listen to them because they survived in an environment that other people have not survived in. But they can't help themselves. Now, those who are obese, now they can help themselves. There's a certain amount who cannot help it. Their genes, the metabolism, whatever's going on with them is such that they cannot help the weight that they're carrying around. But we know that about 90% of the people who are obese can reverse that. They're only there because of habits, bad lifestyle, eating the wrong food because that's what they were taught, not getting any exercise because they thought it was okay not to get any, living with people who are participating in poor behavior in terms of lifestyle. I mean, our brain is the only organ that cannot be replaced right now. And this is where all the information comes into, and all information is gathered and analyzed. We should be protecting the brain, because if you protected the brain, you got all the right information and analyzed it correctly, and you want to stay alive, you would not be obese, because you would eat the proper food and you would get the proper exercise, and you would do all the things that needed to be done to keep the weight down. Now you might say, oh, well, there's people who are poor and they can't afford this expensive, healthy food. Well, healthy food is not necessarily expensive. There's lots of food that you can purchase, that you can prepare yourself, that doesn't cost very much and is not such that it's going to keep you in additional poverty because you spend the money on it. So all of these factors that I'm mentioning here are factors that cause a problem for individuals who catch COVID, and why the mask mandate should not be lifted so early. People with tuberculosis, people who smoke. We know lots of people smoke, although Surgeon General has said years and years ago that it does cause cancer, but we do it anyway. So some people are going to die anyway because they just are prone to do that, because they just won't follow the rules. They won't listen to logic, won't listen to reason. They have mental health and or behavioral problems that haven't been addressed, and so they cannot do any better for themselves. So let me leave you with this, and this is what you already know. The vaccines work. Take the vaccine. If you haven't taken the vaccine, take the vaccine. I mean, how long has it been you've been worried about the vaccine and not taking it, and people who didn't get it, who didn't, people dying, people, not having to go to work, shutting down this, shutting down that. Now they're trying to get it all open, and you still haven't taken the vaccine. Well, now you could be contributing to the next generation of those people who are going to get infected with the new variants that come along, because most everybody else has been vaccinated, but not you. So you're the one that's going to be the next generation, and it's getting worse and worse and worse in terms of how virulent these variants are. So that's number one. Take the vaccine if you have not taken it. It works. If it gives you a third eye, which it does not, then good. You'll be able to see more. Give you another foot, then boom, you can run fast and kick more, whatever you want to kick. But you'll be alive and you won't be infecting other people. So take the vaccine. Number two, take the booster. If you haven't had the booster, take the booster shot. And now there's a second booster that you can take. Take the second booster. I plan to take the second booster as soon as I am eligible. So we know that there's three major vaccines that are available. One is Pfizer, the other is Moderna, and then there's Johnson & Johnson. You can pick from either one of those. They're a little different, but they all work. They all are safe. And remember, children under 5 are not vaccinated. No matter what you do, remember that we're not saving our children. We're not protecting our children. We're sending them out into the traffic without looking both ways. Until next time, your history and health comes first. Thank you very much. This is Dr. Richard Brown. I'm signing off.
This has been Your History and Health Comes First with Dr. Richard Brown. And you can leave suggestions at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.